Good afternoon, Rotary Club of Harrisburg, club number 23 in all the world. It is so good to see everyone here looking healthy and safe on a beautiful Monday afternoon. Real quick housekeeping note as we get started. Remember, we are in a Zoom meeting. Of course, everybody knew that, right? But if you'd like to do a close-up view of the speaker, remember the icon in the top right-hand corner of your screen where you can do speaker view. And when you do that, you just tune everybody else out and you're looking just at the speaker. No one else will even know. Use the chat function as the meeting goes along. And again, we look forward to today's jam-packed Rotary meeting. We'll start our meeting with an invocation. Carolyn Dumaresque, are you out there somewhere?
Yes, I am, right here. Can you hear me?
You are in business.
Okay, thank you. I thought I'd share this morning a quote that I found from Helen Keller, because for so many of us, our lives have changed. Most seriously, if we've lost a loved one, or we've lost an activity, or we've lost a job. So I thought it might be appropriate today just to share that quote that I like so well. And it says, "What we once enjoyed and deeply loved, we can never lose, for all that we love deeply becomes part of us." Helen Keller. Thank you.
Thank you,
The
Carol.
dogs like it too.
The dogs liked it too. Thanks so much. Adeline, you have, I think, America the Beautiful in queue. There you go. That's right. I must admit, halfway through, I was wondering, what song is that? But join me, if you could, in the Pledge of Allegiance. I pledge allegiance to the flag of the United States
of America,
and to the republic
for
for
which
which it stands, one nation, under God, indivisible,
indivisible,
with liberty and justice for all. Well, we've got a jam-packed meeting today, and I'll take a minute just to do a few announcements. Big thank you to Deb Abel for taking minutes. Again, as I noted earlier, and I'll remind you again, please, Deb, remember the four-way test as you are taking those minutes. A great big thank you to our corporate members, Capital Blue Cross, UPMC, Hospice of Central Pennsylvania, Goodwill, Keystone Area, Highmark, and Harrisburg Regional Chamber. We so appreciate your support. Your encouragement and your financial support helps us to do so many good things in our communities. Lunch money. Today's lunch money will be donated to Downtown Daily Bread. It's another way that our club is helping to support folks who are really involved in doing some important things in this time of need. Now, if your lunch money is not included in your dues, then you can just hop on out to the website here and click on the donate button, and you'll be able to make a donation directly from there. We welcome today a new member, Stacy Fry, and just because of the way my view is set, I'm not sure if Stacy's here with us today. I think she is. So everybody give a great big Harrisburg welcome to Stacy Fry. And as Zoom meetings go, she of course couldn't hear us applauding. A great way to welcome her maybe is just hop on out to LinkedIn or Facebook and send her a connection request. We're one slide ahead, Adeline, but just leave it right there. I want to do a real special welcome to any other guests that we have joining us today. Our district governor-elect, John Anthony, is with us. I understand that he dropped in to grade my performance. So John, I hope you'll be kind to me when the meeting is over. Rotary really does open so many doors of opportunities, but it is really on us as members to take advantage of those opportunities. And today we want to highlight two ways that you can make sure you're staying connected. One way is to make sure that your contact information is current and up to date. Now, you should have received an email that looks like this one. The email subject line says request for update to member profile. This is super easy. You just click on the update button and follow the directions to make sure that your contact information is up to date. This is so important. I want to tell you, actually this morning, I had just jotted a little note, sent it in the mail to one of our members, and it came back as a bad address. So, so make sure you again, update your information, click on the update here, and that'll be really helpful to us. A second way to really walk through some of those opportunities that Rotary opens is to join a committee. Now, if you've been to our Rotary Club of Harrisburg website over the past couple of months, you may have noticed a few changes that are starting to occur. One of those is that there is now a button on the website which says join a committee. So it couldn't be any easier than that, right? Just click the button, and what'll happen next is you'll go to a web page that looks like this one. And you just scroll down that web page, highlight the name of a person, and you can click on that name and send an email. So we have committee chairs that are listed there. You find a committee that you're kind of either involved with or you'd like to know more about. Click on the name of the person. You'll be able to send them an email and just communicate with them very directly. So we'd like to see everyone involved in committees, and we want to make it as easy as possible for that to happen. So we'll take a minute and look and just view a video, again, that talks a little bit about some things that Rotary International Foundation is doing in the middle of COVID.
During this emergency, the 13 Italian Rotary districts, including more than 900 clubs, responded to the crisis with a coordinated strategy, focusing on disease prevention. With the Rotary Italia project, Prevention to Defeat the COVID-19 Pandemic, worth €1,300,000, we want to offer to 28 hospitals in Italy, which are directly involved in the fight against COVID-19, an innovative technology package to minimize the risk of infection of healthcare workers and interrupt the virus transmission. The project aims at equipping each hospital with 2 thermoscanners to instantly detect the presence of fever, a COVID triage unit, an isolated cabin where it's possible to safely perform triage, and a stretcher for transporting the infected patient by protecting the healthcare staff from exposure to the infection. The project aims at responding to the most urgent needs while providing tools that could help healthcare facilities in the long term as well, in the event of another spike in infections or for future research and development. Rotary connects the world, says our motto this year. With this project, we want to allow the world to be able to safely reconnect again in the next future. Together, we can bring positive change to our communities. Together, we can save lives.
What an incredible video. Good afternoon, folks. District Governor-elect John Anthony here, bringing Rotary greetings from the district. As you're aware, our theme next year will be Rotary Opens Opportunities. The Rotary Foundation has such a powerful story and is one of the many ways that Rotary opens so many doors of opportunities. And the donations that come from Rotarians just like you is the lifeblood of the foundation and make it all possible. I understand that everyone in your club who made a donation this year has had their name entered into a drawing. These 10 people won the drawing and will appear on a billboard. Congratulations, one and all, and thank you all so very much for your ongoing support of the foundation.
Thank you, John. That was well done, and I'm so looking forward to working with you. We're all looking forward to working with you in the coming Rotary year as our district governor-elect. We appreciate you dropping in. You know, as we prepare to introduce our speaker today, I do understand that one of the program committee members will be doing that introduction. And this gentleman, I don't know if he is the program czar yet, but I think he's running for that position. And I so appreciate working with John Moorfield. He is a great person to work with and does a good job on the program committee. John, I'll turn the electronic podium over to you to introduce today's speaker.
Well, thank you, James, and I don't think anyone could take the place of our past programs are. So I will just sort of comment that we got a great committee and certainly appreciate the great work of everyone else involved. Today, I'm pleased to introduce our 5th in a series of virtual programs related to the regional implications of the coronavirus pandemic. When the program team met to discuss what speakers might resonate, we realized it was beyond the leadership inside of the medical profession and governments that we needed to consider. The implications for people, and particularly the voice of the underserved, were an important component of our conversation. And as we started to think about it, and certainly as businesses shed workers while they reorganized in the face of the pandemic, broader regional implications started to occur. According to NPR, Hispanics and Black Americans were more likely to be laid off than white Americans by a ratio of 3 to 2. According to CNBC, women who make up nearly 50% of the workforce, make up 60% of the job losses related to the pandemic. Reflecting on this, it didn't take long to think about someone who could speak to this very directly, Joyce Davis. Joyce has enjoyed a rich career and somewhat trailblazing career as a journalist, broadcasting, and media correspondent, including her most recent stint as Director of Communications for the city of Harrisburg under Eric Papenfuss's leadership. I believe this is the second time that Joyce has spoken at Harrisburg Rotary. I recall a presentation at about 2007, shortly after she joined WITF, where I first met her. Immediately prior to this, her most recent work experience, Joyce was the Associate Director of Broadcasting for Radio Free Europe in Prague, Czechoslovakia. In that role, she supervised radio and internet services in Iran and Iraq, and the countries of several countries in Central Asia. Through it all, Joyce has spoken to the needs of the underserved. When I called her to ask to present, I asked her specifically to speak to the challenges that the underserved faced. And I then acknowledged that I did so as an older white guy. Joyce promptly said, "Well, that's funny. That's funny because generally I'm one of the people that is really trying to talk to older white guys as we wrestle through these issues." And her organization has done a great job in that regard. Now, before I give up to the mic to Joyce, I also want to acknowledge one other thing that is not ironic, but is concerning. Over the weekend, I emailed Joyce to check in. And to the point of my earlier comment, I got an out-of-office auto reply. She was furloughed from PennLive in an on and off experience. And so to that end, I'm particularly grateful for her willingness to speak directly and candidly to these issues. Thanks, Joyce.
Thank you. Well, that's quite an introduction. Thank you, John. And of course, we worked together on several difficult projects when I was with the mayor's office. So I appreciate your doing the introduction. But I also want to thank all of my dear friends at Rotary Harrisburg. This feels like home. So we're going to have a conversation, I hope, rather than a lecture. But you know, I care about the world in addition to here. And so yesterday, I actually did a Facebook Live with, and most interesting man, the former lead negotiator for the Iranian team in the nuclear talks with the European Union. And he talked about the difficult time Iranians are having because they're under embargo, they can't get medicine, even though they're facing incredible problems and illness with the coronavirus. So, but we're going to focus not only on the globe, I always like to at least bring that out, but also here at home. And one of the things that I think is coming to sharp relief is that even though this virus spreads and does not discriminate at all, the impact that it is having can be different. And race, class, education, all of that can play a part in how well you are able to survive. So that's why we chose as the topic race, class, and COVID-19, and what we've learned about surviving in a pandemic. So, and yes, I am on furlough this week. Everyone at PennLive is being asked to take a week of furlough. So this allows me a little freedom to think and to relax and to join you here today. Otherwise, I'd be doing a Facebook Live, which I've been doing every day for PennLive on the coronavirus. We call it the coronavirus Q&A. And it has allowed me to really almost become an expert in how we've dealt with this issue in our region right here in central Pennsylvania. And I want to talk about, I guess, 3 issues that I think, in addition to race, class, and all of that, but the issues that are coming to the fore are health disparities. That is definitely based on race and on class. Economics, again, race and class, and education. Race and class, but also, are you willing to hear actual voices of science? Are you willing to have an open mind and accept as much information as you can get before you decide on a course of action? So let's start with the first one. Clearly, you've laid out some issues there, John, some statistics that show that African Americans, Latinos, as far as race, are being very hard hit by this virus. In April, at a press conference, Dr. Anthony Fauci, who's the US leading expert on infectious diseases, spoke at the press conference, and he simply said that communities of color, particularly African Americans, are having an extraordinarily difficult time dealing with this virus. He says when all this is over, it, as we've said, it will end. We will get over coronavirus, but there will still be health disparities, which we really do need to address in the African American community. These disparities, he says, are linked to early numbers that show African Americans are disproportionately dying from COVID-19. In Michigan, Black Americans make up 14% of the population, he pointed out, but account for 41% of coronavirus deaths. That's according to the information released by Michigan's government. Now, when we get on a larger scale, the Associated Press analysis has showed that African Americans account for roughly 21% of the total population in areas that they looked at. But their deaths were far more disproportionate according to their numbers in society. Now, before I get too deep into numbers and all of that, and including looking at what they are in Pennsylvania, I want to tell you honestly, I don't think we can really trust these numbers. I've had I did a Facebook Live session with two coroners, Hetrick and the York coroner, in which they also worry that the numbers that we're seeing to be able to say who's contracted the virus, how they fared, who died, who didn't die, those numbers are probably not accurate. They're doing the best, not that there's a deliberate attempt necessarily, but the thing has come about so quickly and with such little foundation for us to be able to deal with it, that people are taking the best guesses. And sometimes even the cause of death is not being recorded properly during this pandemic, according to these coroners. So as we look at the numbers, we really can't take it as gospel truth. But here's what we can say. We know this is killing a lot of people. We know that it is easily spread. And we know that as we look at the numbers that they have organized, it is disproportionately affecting people of color and people who have little health resources, ways to be able to take care of themselves. So in Pennsylvania, of 26% of patients the Department of Health released this data on, about a third of the patients in Pennsylvania are Black, although Blacks make up 12% of the population. So locally, we're seeing such a disproportionate impact in minority communities that Governor Tom Wolf and Lieutenant Governor John Fetterman have announced a task force to try to get accurate, because at one point they weren't even keeping racial or demographic classifications on the people who are dead or the people who were admitted into the hospital, but they're trying to figure out a way to get that data so that they can really effectively analyze just what this is. But there is a task force underway that is really looking at what this means for Pennsylvania. But when we look at health, we have to look at one issue that I think we can't avoid, and that is the residue and the vestiges of racism in our country, the vestiges of slavery. The fact that African Americans, by and large, have had lack of access to quality health care, have not, in many cases, trusted the medical establishment, a big issue right there. and have not necessarily had access to quality food, many times living in areas where there are food deserts. They're not able to get access to vegetables and to keep the nutrition at such a way that will keep them healthy. We know that African Americans and many Latinos suffer from issues of diabetes and high blood pressure. We also know that because of economics, and here we get into the class in economics, they've had less access to healthcare, to health insurance, to those issues. These things have directly come into sharp relief when you have a pandemic. Because what we found in this pandemic is that while there's no genetic reason why African Americans or Latinos should be more likely to die, they are, because they have these underlying health conditions of diabetes, of high blood pressure, of heart disease. Those things mean that if you contract the virus, and guess what? If you don't have health insurance, you are unlikely to be able to get the help that you need. And even if you were able to get the help that you need, those underlying conditions mean that you're going to suffer far worse. So, but the other issue that we're looking at, so again, it's the vestiges of racism that have impacted the health of this community, but we're also looking at another aspect. Health, yes, but then we know we're also looking at economics. You brought that out about who's being laid off, but let's face it, you've got two dilemmas here. You've got people who can't work, who are laid off, who suddenly find themselves without income. What are they going to do? If you're a single mom and you've got 3 or 4 kids, what are you going to do if you're laid off and can't support your family? Who's going to help you? What are you going to do? Do you really think $1,200 or $1,500 it'll get you through a week or 2? But then what, right? But then what about the people that do have a job to go to, but going to that job exposes them to the virus? That's the other thing. Yes, the people that have had to sustain and keep our economy sustained during this time are those people reporting to the meat packing places, those people reporting to the food processing, those service people, the people who, no matter what, they're going to go to that job, even if they don't have the protective gear that they need to keep them safe, even if it means they contract the virus and bring it back home. That has been the reality, the economic reality of this virus. And that economic reality has not only impacted, it has largely impacted Blacks and African Americans, but it's also impacted people who don't have higher ed, don't have the education, the jobs that will allow them to have time off without pay, the jobs that will not allow them to speak up. I will tell you, I interviewed the president, and it broke my heart, of the local union, who talked about in the past weeks, he was just 7 people had died who had been associated with one of the meat processing plants. He had hundreds that had tested positive. Now, these are people going to work, and they are being represented by a union. But the union had to step up to try to make sure they had protective gear, to try to make sure that they were being tested, to try to make sure that procedures were being put into place that allowed them social distancing. If no one was advocating for them, the question is, would they simply be disposable people? That is what we're looking at here. These are moral issues that I think we're going to have to face as a society. The final thing is education. The fact is, people who do have some education have had it better. They've had it better in that they could advocate for themselves. They were aware of where to get the information, and they understood who to listen to. They could perhaps better filter out a lot of the noise that was out there. And I will tell you, one of the most disappointing things that I have seen is the lack of clarity that's come from our national government. It should be clear what the guidance is. It should not be a haze that's being issued especially from the president. We cannot have people think this was a hoax at the beginning. Now, we know that he didn't necessarily mean what he said, but those messages resonate, especially with people who may not think to look elsewhere for information. That, I think, has been a tragedy, and one that I think we need to look squarely in the eye and say, we need clear, in a pandemic, in an emergency, we need our leadership to be clear, honest, and forthright. Lives are at stake. This is not politics. This is truly about saving people and helping people during a time when they need clear leadership and guidance. So that's one. So where does this all leave me? It leaves me with trying to figure out, what could we do? What should change about all of this? And I will tell you that I published an opinion piece from Joanna McClinton, who is one of our Democratic member of the Pennsylvania House of Representatives, representing Delaware County in Philadelphia. And she spoke quite eloquently in this op-ed about the health disparities and about what the African American community is facing. And she is recommending access to hazard pay for all people who are having to go and work on front lines. And, you know, I think Bob Casey also has brought up a GI Bill that he wants to be able to support people who had to report to work during these times with some sort of educational funding or some sort of support after this is akin to the GI Bill. So there are ideas out there of how to address what we are seeing now as these disparities. So access to hazard pay, emergency paid sick leave. This is a key one. Listen, it's clear to me that I can take care of myself and my family all I want, right? I can make sure we have health care. My house is disinfected every 5 minutes. I'm spraying everywhere, right? But as soon as I step out of my door, if someone is sick who touches the same can of tomato paste that I'm going to buy at Giant, I'm going to get sick. I have to now realize I can't live in the world alone while other people are sick around me. I'm not going to be well. This is just how Joyce sees it. You may not see it that way, but I realize that I'm inextricably connected to my community and to people around me. And so if people around me are ill, if they do not have access to sick pay so that they can stay home and not go to work when they're sick, they're going to carry that virus into Giant, into the Dollar General, into Macy's, wherever it is that I'm going, and I'm going to catch it. So that's number one. People have to be able to stay home when they're sick, sick pay. And the opportunity, she says, for people to earn at least $15 an hour. Now, I will tell you the other thing that I believe has come into sharp relief with me is, and we have to think about this, and I've discussed it. I do a Battleground PA podcast, by the way, with Jeffrey Lord, who I've come to adore. Jeffrey Lord, who's a very big Trump supporter and a very staunch Republican, and Rajette Harris, who is an up and coming young Democratic leader. Okay, so I have the old guard with Jeffrey, who's got this long history of being in the White House and Reagan, and he'll tell these stories. And I have Rajette, who's up and coming, and she's feisty, and she's not even all the time towing the Democratic line. She's an independent thinker. But I talked to them about, are you guys rethinking at all this issue of healthcare for Americans? I mean, even Jeffrey says, yeah, he thinks we have to rethink this. There has to be some better ideas put out there. What do we do to make sure that when fellow Americans, at least fellow Americans, let's start there. Let's not start with undocumented people, but let's start with fellow Americans. When they are ill, there is no question they have health care, and they have health care that they can afford. How it comes about and how you make it happen is a question for people to work through. At one point, I remember getting to an argument with my son over this, who's a little bit more liberal than I am, saying you got to have a way to pay for things. You got to have a way you can't just throw stuff out there. You got to think through how you. But when I realized that we found $3 trillion all of a sudden and have sent out, and we needed to, I'm not objecting to that. I realized, man, we seem to be able to find money for those things we consider priorities and important. So my question now that I'm asking is, as we go through this pandemic and we see how it's hurting people, and we realize we're not immune. None of our families are immune from this impacting us very directly. So when I think about that, I realize shouldn't we be thinking and considering healthcare for all Americans as a priority and figuring out how it's going to happen, bipartisan, how Republicans and Democrats and independents and whoever will come together to fashion something that takes care of our people. I will tell you, as you pointed out, John, I've lived 3 times around the world. I've lived in Greece, I've lived in Paris, and I've lived in the Czech Republic. And I have had a chance to really talk to people around the world, and other people have figured out how to do this. It does cost, it does mean, but it has to be your priority. It is not an insolvable problem. It can be solved. We have to have the will to do it. And my question is, has this pandemic and has this virus opened up a door for us to really address this issue on a human level? Not on an economic level, yes, but on a human level. And so as I look at all of this, you know, I realize that people are trying to do the best they can. And that's another thing I will say, that this has been a very difficult time, I think, for our elected officials. Having been, look, if I'd only been on the journalist side of this, I would not be able to look with a little bit of compassion and understanding at how difficult it must be for elected officials, governor and others, including the president, to have to make decisions and to have to deal with something that has no playbook, that is something no one else has really faced. So a little bit of cutting them some slack as they try to go through this, I think, is in order. And at the same time, we do have to keep the pressure on so that they don't get comfortable. This is going to take sharp thinking. This is going to take people always looking at, do we need to change? So we are right to keep pushing the governor. I think, isn't it time to reopen? What is the plan to reopen? What are we doing about the economy? What are we doing about businesses? I think all of that is great, because what we're seeing is that the people who are suffering most from this are indeed people who are on those front lines in those service occupations. They are mostly African American and Latino minority people. And the people who are suffering are those who have few advocates for them in politics and society. So with that, I am going to say that concludes my opening, my overview there. And I would love to be able to engage with you. And look, I know not everybody views all of this the same way. One of the things I've tried to model with our Facebook Lives for PennLive that I've been doing, we can disagree civilly. We can debate with respect. We don't need to name call or attack each other in order to share ideas that may differ. So with that, I would urge anyone who says I'm absolutely wrong to say it now, and then I will respond with respect.
We have, thanks so much, Joyce. Just let's give her a round of applause.
Thank you.
Yeah, we do have 3 questions so far, and there's probably bound to be more. But boy, you've opened several cans of worms.
That's what's good.
Yeah, so, you know, is there any, are there any statistics or data about the impact in, say, like the homeless community specifically? Are you aware of anything in that regard?
I'm aware that there is a problem that people are trying to, but there are no, I have not found. In fact, I had a Facebook Live with Mayor Pappenfuss 2 weeks ago, and I specifically asked him about the homeless population in Harrisburg. And I know that they're doing what they can to try to help, and they're especially the law enforcement have been looking to try to see who's vulnerable and where to get them help. But nobody's really keeping statistics. This is part of the problem. The statistics really are not reliable for any of this stuff. So no, but I will say this, the other thing that I put out there, someone else, I believe someone from Blue Cross or something had put out an announcement on Facebook that if no one should go to bed hungry. And I reposted that on my site. No one should go to bed hungry. If you really are hungry, if you need food tonight, let us know, we will get it to you. We did get some takers on that. And luckily there were people who stepped up and said, I'll bring put it on their porch. So at least anyone who stepped up, I knew that there were people out there who were going to be willing to take care of them and at least leave a bag of groceries on their porch.
Thank you. Ted Reese asks, what local programs or agencies are best prepared to help marginalized people right now? And,
Well,
and
yeah.
which ones will continue to do that in the long term?
Well, let me say this. One of the things I tell people, and I had Tim Fatzinger on too to talk. United Way has a 211 number. That's an emergency number that if you need something, call 211. I always repeat that number. But we have, for example, my son is now volunteering since, with Meals on Wheels. They're continuing to be out there bringing food, especially to elderly people and people who are in need. So there are any number of organizations still functioning, many of our church groups, part of the people who've stepped up, including many of our Muslim organizations, have contacted me to let me know if you know of someone in need, we're willing to step up. The Ahmadiyya community that we know with the Hadi Mosque, they've been phenomenal in trying to reach out and to help people. But United Way of the Capital Region is one key place. Check their website. They have all kinds of programs that people can help with.
Thank you. Una Martone asks, can healthcare for all be turned over to physicians and hospital systems rather than left to politicians? There is no way to keep politics out of it, bipartisan or not.
Una raises a very good point, and I'm going to tell you, that's one of the tragic parts of all of this, that politics and all this enters into something like this. It should not. I should not doubt that what a doctor or an official is telling me about this virus is in any way shaped by politics. I want the unvarnished truth about this. You can still have different opinions on how to tackle the problem, but we want the absolute facts and truths about a health thing. For me, it isn't a question of the system. I just think we all ought to get on board that it needs to happen and then figure out the right system. And I will say, I think Jeffrey Lord is on track, agreeing with me with that. In fact, he said one of the things he screamed about is that as soon as the Republicans took charge, they should have had their plan ready to go to deal with this and not simply attack, but have something ready, thought out, boom, here's what we're going to do and get it done. And then that issue is over. It's been dealt with by the Republicans and yay, I'd be very happy. But we need to do it. I don't know we can look around the world and see where it's worked, how it's worked. That, I could probably pull together a research paper in a week or two to tell you who's done it right and who hasn't done it right. That information is readily available. We just have to have the will as a people, and I'm not even talking political will, as a community to say, yes, this is the right thing to do. There's nothing more key and fundamental than making sure when someone is sick, they can get the medical care they need and it won't bankrupt them, or they won't be turned away because they can't pay.
Yeah, thank you. John Moorfield asks, several countries are taking a more autocratic approach to resolving these issues, as this might abridge trust. How do you think we can come together really and wrestle through this issue?
That is a very good one. It is clear, if you were in Singapore and you were told to do something, you're going to do it. If they tell you to stay inside, when I was in Singapore, I knew if I chewed gum, I'd better not drop that paper on the ground or it could have serious repercussions. So yes, indeed, what you're saying is true. If you're living in a more autocratic society, if you're living where if you do not toe the line, there are really serious repercussions. You're going to have fewer people walking outside without masks. You're going to have fewer people defying you. Unfortunately, we live in a different society. I say unfortunately that we value personal freedom a lot, right? We value a personal expression. So we are willing to take a little bit more risk in our society to allow that personal expression. Although I think this is going to tax us here. I mean, look, I am not going to be happy when I go back into the world, as I hope to do one day, that I'm with someone who sneezes on me and doesn't seem to care about it. I'm going to really be a bit concerned about that. How far, in fact, I wrote an editorial on this, how far are we going to go to legislate the proper behavior during a pandemic? are we going to make it a criminal offense if you sneeze on someone without your mask? Or what are we going to do that balances personal freedom, that balances those things that we respect with the need for stringent public health safeguards? That is a question that we as a society are going to have to address. Do we want to? I do believe this. I don't want to live in a despotic society. I've been to those. I know how they can feel. I remember even being in Iran, and I just wanted to sing a little lullaby to a child, and I was doing like that was too provocative, and I could get arrested or beaten. So I don't want to live in a society like that. On the other hand, I also want to make sure that we are protecting in our society the most vulnerable people. I don't want to live in a society where lives are dispendable or disposable, where if you happen to be over 65 and you have diabetes, then okay, you're just going to die. You're going to take the risk, but we got to keep going on with our lives. And that I don't want either. So that's the other extreme. There seems to be we should be able to do a balance. And I don't think it's too much to ask our elected officials to take the lead in finding that balance.
Thank you. Thank you, Joyce. And yeah, boy, what a can of worms. We could probably spend the afternoon here. I appreciate what you're doing with the live sessions anyway, and just really bringing people together and giving them an opportunity to talk. And I do know from the comments here, Steve Schwartz mentioned
the Compassion Action Network. Yeah, Christy, very good. Yeah.
That's right. Some good things happening right here, in our community, and the Central Pennsylvania Food Bank, of course, helping to connect people. So we appreciate, again, everything that everyone is doing, and I appreciate you, Joyce, for bringing, this message to our podium here today. Did I get this? I'm trying to decide if this was a question. Long after this pandemic, school children will be behind in their education.
Yeah.
This certainly most significantly affect minorities in poor districts. How do you see this being remedied?
Thank you for bringing that up. That is another huge thing. Look, it is, I remember having a discussion with the editor saying, well, at PennLive, they're saying, well, the one good thing about this is that all the kids are going to be behind when they get back, right? All right. Yes and no. Kids who, were already online and on par with their achievement will be behind a little bit, and they'll quickly catch up because they'll have all the tutors and they'll have all the special help that they need. If it's my child, I'm going to get them. I'll pay whatever it takes to get them caught up to where they need to be. But those kids in Harrisburg High or in some of the Harrisburg schools are not going to have that luxury. They're not going to have special tutors helping them. They already were behind. And you and I know, if you're behind educationally, if you can't read, listen, I will tell you a story that I tell people all the time. I had, we do the internship program with the World Affairs Council, and it generally brings in some pretty talented and globally educated, students. But we mix it up. So I brought in also a student who had graduated from Harrisburg High and who'd gone on to Florida A&M. And he was in there with kids from Cumberland Valley and Harrisburg Academy and all that, high schoolers. And at one point he looked at me, African-American young man, he looked at me and he says, Dr. Davis, I am angry. I said, whoa, Tawan, why are you angry? He says, I'm angry because I now realize how much I've missed. He says, this is what he told me. He says, do you know my last year in high school, I didn't have to do anything. I did nothing. The only thing I did was what I probably decided to do. I said, what do you mean? He says, it was a wasted year. So if you have a system, I'm not saying that system is any more like that in Harrisburg, but I'm giving you an understanding. If you have a system where you have talented, gifted kids who are not given the resources, and then they deal with something like this, and they have to come back into the system, imagine how behind they are. What will it take to bring them up to a standard that they can have any hope of catching up? That's where we may want to put our efforts. When these kids, especially in Harrisburg, come back to school, how can we mobilize an army of tutors and volunteers and people willing to hang in there with them, because they're going to need extraordinary help to be able to get back on any kind of playing field for their grades. So please keep that. Maybe that's one of the things the Rotary can do, organize tutors that will focus on Harrisburg students. Thank you for bringing that up. That's a wonderful, wonderful question.
Yeah. Thank you. Thank you too. And, you know, for everyone who posted questions, you know, hopefully I'm not missing questions. There's a number of comments here, and again, we appreciate good job though, Joyce, really. And somebody, Ski, I think, said Joyce for governor or mayor or whatever. So
Dr. Ski for president. Dr. Ski for president.
That's right. Let's give it up for Joyce. Thanks so much. Give her a welcome, or give her a thank you for being here. And again, we appreciate you so much. Don't stay a stranger. You know, we'd like to see you around more often.
Absolutely. And thank you all. I really enjoyed being here.
Right. So, well, Rotary Club of Harrisburg, Club number 23. What a presentation this was, and a great big thank you to our program committee for putting for helping to make this happen and really bringing it together. You can help to have some input in bringing programs like these to the table. The program committee has distributed, right, I guess, a survey, and you should have received. And, you know, we'd really like to have your feedback and your input. And so if you don't have that in your inbox, send a note to Adeline and just say, I didn't receive it. But when you do see that in your email, take a minute, fill it out, get it back to us. And that way the program committee can keep putting together incredible programs like these. We'll be hosting virtual meetings through the end of July, right now, through the end of July. And so we plan to be doing more of these Zoom meetings. No meeting next week. It's Memorial Day, but we'll be back here again on June 1st. So thanks to everyone again for your participation, for being here in our meeting, and make it a great Rotary week and a great holiday as well.